Hi, everybody. Thank you so much for joining us today. My name is Jasmine Akins. I am your PrEP program coordinator here at CAN Community Health. Today is an incredibly special day. So if you don't know, today is National Women and Girls HIV/AIDS Awareness Day. Today is very special for many, many reasons, and we're going to share that with you today. So you are in for an incredible treat. I have two very, very special guests here to join us today to have this important discussion. So I'm going to bring them in and I'll let them introduce themselves to you. Hi, everybody.
Hello.
Hello.
Hi.
Hi. It's so good to see you guys. Thank you so much for joining me today. I would love for you to introduce yourselves a little bit to our viewers who are watching. So tell us who you are and maybe a little bit about what you do here at CAN.
Okay, I guess I will start. My name is Nadia Winston. I am a nurse practitioner at the CAN Arlington, Texas location. So what I do here is primarily HIV primary care. We also do PrEP and MPEP, as well as some STI testing and treatment, as well as Hep C. So I've been here approximately for almost about a year and a half now, and we're really busy here in the clinic.
Oh, I bet. I bet. Well, it's so good to have you.
Thank you.
My name's Debbie Sergi-Laws. I am Medical Peer Navigator Team Lead throughout CAN Community Health, but my location is generally Sarasota, Florida. I'm also a speaker on our speakers panel and facilitator of our women's support group. So I've been involved with CAN Community Health pretty much since its inception over 30 years ago. And I am a woman who's living with HIV and have been for over 34 years.
Wow. Well, thank you to the both of you so much for being here and sharing your expertise and your stories and for your advice and your knowledge with everyone that we have here. So I really appreciate it. So I do want to get started. We have quite a bit to tackle. So I wanted to share some statistics with the folks that are watching, and maybe you're thinking, okay, we have World AIDS Day, we have HIV Awareness Day. Why do we need very specific days for different populations or groups of people? And that's a good question, valid, right? And so, just to give us a little bit of background info, so when we look at HIV in women specifically, women account for more than half of people living with HIV worldwide. Young women, so if we're looking at folks, between 10 and 24 years old, are twice as likely to acquire HIV as young men in that same age bracket. So we're looking at some very, striking, in my opinion, statistics, and so that is why we have this conversation. In addition to that, we know that HIV disproportionately affects women and adolescent girls because of some of those unequal cultural, social, and economic status vulnerabilities, right? All of those things make women vulnerable, and so it can, correlate, right, to some of those higher numbers that we see. So that's kind of where I would like to start our conversation with you both today and just give us some of that info. So the first question I would love for us to start on is, when we look at women and girls, what types of cultural stigmas or differences make women and girls more vulnerable to HIV? And we can start there and then kind of build on that.
I will just pick out one thing. I will talk about maybe in some countries there is some cultural differences between men and women. Some countries prohibit the use of condoms, and so they're not supposed to be using condoms during their sexual contact with their partners, and so this kind of disempowers them. They kind of don't have that protection if they are going to be sexually engaged with a partner. Also, intimate partner violence.
Mm.
Um, there's evidence that even some men are likely to resort to violence to express their dominance among women, and also coerce them to have sexual activity. So um, that's what I would kind of start off with. I don't know if Debbie would kind
Yeah.
of piggyback off that a little bit.
Yeah, I think that one of the main differences is that women just don't think it can happen to them. Women are in this mindset that it's those type of girls. And I know I was, and I think many of women and many of us want to believe that because it's just safer for us to think it can't happen to people like us, to women like us, and that definitely puts you at a higher risk because then you're blocking out any means of ways to protect yourself
Mm.
and to make wiser choices and wiser decisions. So I think that, one of the main things is still, even in 2022, women want to believe this isn't happening to us and it can happen to any of us.
Yeah, you both said two particular things that I want to go back to really quickly. Nadia, you had mentioned that in certain places in the world that condom use is prohibited. Can you talk to us a little bit more about that? And if like what's the culture behind it, or like the thought behind it, and just to give our viewers a little bit of insight on that.
I would definitely try my best to elaborate. I do remember back when I was a grad student, I did a paper about sexual violence among women in the Congo,
Mm.
because we got to remember that, we're talking about a worldwide thing. The numbers for women and girls is very high with HIV, even in these other countries. And one of the issues that came across in my research was the fact that there was this negative mindset against condom usage in these other countries, India, Africa, certain tribes. It wasn't seen as something that the women or girls should have access to. And so, what you know, when you don't have when it's looked down upon in your culture to not use condoms, how do you protect yourselves? And in our Western society here, we do have condom availability. But going back to what Debbie was saying is that, okay, we had the availability of these condoms, but again, women are unaware, or they lack awareness, or like a heightened awareness of the fact that it can happen to them, so they don't use those actual resources to protect themselves. Um, so that is kind of and when I wanted to kind of pinpoint on. And I'm not saying that, also going back to intimate partner violence, it happens here as well in our Western society. Some women are in these um, unequal or unequal relationships,
Mhm.
and they in these unequal relationships kind of shadow the fact, or basically put a covering over their eyes, to the point where they um, don't or do not see how vulnerable they are to HIV, because they think that, okay, well, this person loves me, even though they're being violent to me, but not aware that it is putting a shroud over their eyes, and they are being disempowered with their lack of sexual choices. So,
Yeah, absolutely. And all of that was wonderful. Thank you for elaborating a bit there. And the reason I wanted to bring that up is because, um, you know, obviously, like you said, around the world, certain situations or cultures may, not look at condoms, but it really does show you,
mhm,
how in certain situations or cultures or where you live, how women, the power over their sexual health, someone else is trying desperately, to contain that control. And so, learning those skills of how to negotiate or to self advocate are so important, and can be difficult, right? Some of those things we have to unlearn. because we've been taught a certain way, or we've only seen something a certain way, and that can be difficult. So, thank you for elaborating on that, Nadia. Debbie, I did want, you were talking about, how women still have this idea, it can't happen to me, or it only happens to those girls. Can you talk a little bit about what girls are people liking to stereotype and put in this bubble? And, I always think, I know the research, I do the education, but sometimes I can't help but feeling like we are in 2022 and we're still doing this. So can you elaborate a little bit on, some of that thinking?
Yeah, I think for a lot of women or a lot of girls, anybody but themselves are those girls.
Yeah.
And, so, they want to believe it can't happen to them. So if you think it's everyone else, perhaps but you, then you don't have to worry about it. And I think a lot, and this kind of plays into what we, Nadia and you all were just talking about, in the role that women play in a relationship, and the confidence or lack of confidence that women, specifically girls, have in the confidence in themselves, but in that relationship too. So, being able to speak up and do what perhaps is what they do know is the right thing or the safer thing is not always what occurs because of that, because of what they fear might happen with the relationship. And I think that many women will, make choices that aren't wise, and they know that, but the concern as to being alone, financially unstable, not having maybe the father to their children part of their lives. So we have so many facets that interfere with good decision making when it comes to women and girls. And having that confidence is something that needs to start from the very beginning in young girls, and not just when it comes to relationship to HIV, in anything in our lives. So I always, when I was diagnosed back in 1989, I honestly, and I'm a registered nurse by profession, so I have background in the medical field. But back in 89, we didn't know a lot, and especially about women. And I remember thinking, well, I'm not a prostitute and I don't use drugs, so why would I even think about this happening to me? But one thing I did do is I had sex and condomless sex. Now, be it was with my husband trying to get pregnant, but even then, I just didn't consider it could be that I could be in risk or at risk or part of those girls, which shouldn't even be a terminology used, but I believe it still is.
Yeah, absolutely. And I think thank you, Debbie, for that. And I think sometimes people get so attached to like the single behavior that they can then like disassociate themselves with ever potentially falling into that group, right? Well, okay, well, that's not me, or I don't have sex with those types of people. And it's like, who are you talking about, right? Because we know, if you're sexually active, there's always a possibility, right? And so that's why in our profession, we are, getting tested regularly, if possible, right? Being able to have that conversation with your partner and get tested beforehand, using condoms correctly and consistently, PrEP, right? All of those different things, U=U, right? Becoming undetectable if you are living with HIV, and, different things like that. So making sure you're taking your medication. So, but absolutely, all these kind of different ideas that we really have to kind of hone in. And I call it Superman syndrome when I would work with my students. You have this, I'm untouchable. I'm, whatever. I'm young. I remember I'm like, okay, and just, really making that a possibility, and then really thinking, okay, what do I need to do in my life to protect myself? And kind of, take away some of those other things. So fabulous. So we talked about culture and things like that. So that was fabulous. But I do want to get into some of those like deeper things. So why would these things make women a little bit more vulnerable? So things like social status, economic status, race, sexual orientation and identity, gender identity. Is anyone you want to tackle? Which one of those?
I will tackle one of them. Why do these things, or why do these things make them more vulnerable? Well, I would say that, going back again to the education thing, when you don't know that you're at risk, you don't know what barriers to put or what barriers to identify to help protect yourself. Okay. And it's just that lack of awareness. And like Debbie was saying, it should start early on. When a young lady, in middle school, high school, but for some reason, in our culture, we try to run away from those areas to disempower women. So what we have now is, when women get older, they're trying to gain this empowerment or rebuild, or they have went through some kind of trauma or stress. Instead, we should do it at such a younger age. So, you know, also, it's just this double standard, and I know that question's going to come up, but this double standard that, women or girls are supposed to be very, meek and mild, just sit there, be quiet, don't say anything, um, as you know, and all the while we're sitting there, being quiet and being meek and mild, we, again, going back, we lack that knowledge, we lack awareness, we lack awareness of the fact that we should be able to advocate for ourselves. And a lot of times we put our trust in the fact, our protection, into somebody else's hands, instead of being able to, being taught that we can advocate for ourselves, and we can, go out here and do it, girl power, basically. That's why it's probably such a big deal today, girl power, girl power. So, it's very interesting. And then, another thing, is going back to the partners. Women's or girls' economic security usually relies in their partner's income or earning activities. So, when you're always relying on somebody else, and I'm not saying that somebody else is going to be a negative influence in your life, but a lot of times, if you don't know you, and you don't know what you like, and what's best for you, and you're always relying on somebody else to give those things to you, you kind of put yourself in a hard rock, or a hard place. So, that's probably one of the reasons why. And it basically, at the end of the day, is gender discrimination.
Yeah, absolutely. When you were talking, Nadia, and you mentioned the double standard, we were going to touch on that, but since you brought it up, I like to ride the wave. It's very true. This was something I didn't put up yet, but like having those unaccommodating attitudes towards sex outside of marriage, and that restricted social autonomy in women, right? It reduces access to sexual health, or even sexual health education. And then the double standard of sex outside of marriage, right? I want to marry a woman that's, the virgin, what they always say. But, for men, high five, if you've got a slew of partners. And so you create a lot of these mixed messages. And if you are a woman who maybe does have multiple partners, or you've had partners in the past, because of how society might make us feel, you might be less likely to go and receive testing, or to share with providers or your partners what's going on. And that certainly can create additional barriers and challenges.
I've also noticed that women who claim or show to have too much information, too much knowledge, too much education when it comes to sex or sexually transmitted infections, HIV, then they are looked at as, why? Why would that person know this much? What makes them want to have this information? If they know this much, there must be a reason why. And is that reason because they're out there having a lot of partners?
Yeah.
And that shouldn't be, our knowledge and our education shouldn't be a bad thing, but sometimes it's looked at from outside as, why are they so interested in this? What brings them to this point of having this much information? And I think that, that just, it's just so wrong, because that would be the best thing for women and girls to have, is information. So and then we talked, like you mentioned, both of you, that for men, things are looked at differently. The more partners you have as a man, the better you are. And as a woman, that is not looked at that way. And so women don't want to share their intimate secrets with anyone. So they may not even get the added support and education from female friends or physicians, because they aren't sharing who they really are for fear of being judged.
Yeah. And Debbie, thank you for saying that too, because, sharing with your physician, and you said fear of being judged, because we know that stigma and judgment doesn't just happen outside of those spaces. It can certainly also happen in the doctor's office, unfortunately. And so, here at CAN, our philosophy is, we treat people fairly, no judgment zone. We are here to provide you with the best care, the best education, so that you can make the best decision for yourself going forwards. That's always, what I love to do and what we do here at CAN. We had a comment that I thought was really great, and I just wanted to highlight. It says that sexual health for young girls always focuses on unintended pregnancy rather than sexual wellness. And unfortunately, I would say that's true. And depending on what state you live in, and then what county, and even down to the school, you may have a very, very different experience. I was a sexual health educator for youth for years, and a lot of the curriculums that would come across my desk for review were these, don't get pregnant. Basically, not really going to show you how that happens, but just don't have sex because you're going to get pregnant. And then often some counties like to separate by gender. And the boys' curriculum would look very, very different. We're talking about orgasms and masturbation and, all kinds of other things, where my girls are just don't have sex because you're going to get pregnant. And then, of course, and then all of like these negative things that can follow. And so I hope that we can get to a point where sexual health is just knowledge. Like Debbie said, it's not looked down upon, it's no assumptions. You need to have this knowledge, right? Everyone deserves sexual health, so that you can make the best decision for yourself. And so I hope to see a world where we can have that very soon. Yeah. Okay, so let's talk a little bit about stigma. So I know we talked about like cultural stigmas and things like that, but can we talk about like why those stigmas make women make them more vulnerable? So we know what they are, but why? What's the why?
Fear of being judged. Let's talk about just HIV testing. Would you say that some women fear getting HIV tested because they fear that somebody may judge them for actually just getting a test to see if they're, have the infection? Or not even just HIV, other STDs as well. Like, you must be doing something wrong, or, why are you doing this?
Yeah.
And then let's just say that you are, that stigma between premarital sex. Like let's say if you were married, you're right, and you're getting an HIV test. Why are you getting an HIV test? And maybe some providers may even have a stigma against their patients. They're like, well, they're married, they're in this monogamous relationship. I'm not going to do this HIV test. Why not?
Yeah. Yeah, we see that a lot of providers not performing HIV tests or even asking about sexual health if folks are married. I get a lot of assumptions from folks that are going to like their gynecologist.
Yeah.
And they're like, when I go to the gynecologist every year, they're not testing me. I'm like, no,
No.
it is not routine testing. You can add it. And I've also heard a lot of providers, oh, okay, yeah, I'll add chlamydia, gonorrhea on there. I'm like, fabulous. Where's the rest of it?
And then I just want to bring in the prevention portion of the availability of PrEP. So in some areas in the U.S., they know all about PrEP, but in some areas, there is a lack of awareness about PrEP. And then in those areas where there's a lack of awareness about PrEP, when you tell some women, and I'm speaking from a provider standpoint, it's like, PrEP seems like it's for people who are promiscuous.
Mm-hmm.
Why do I need to be on PrEP?
Yeah.
Or, instead of like, this is like, a reasonable tool for you. It's just so many stigmas.
And double standards too. I found throughout my time living with HIV and research and experience. I think are we back? For research studies, a lot of the early studies for just general, for medications were not offered to women. And I was like, why? What's the problem here? And a lot of the answers were, well, you're at childbearing age. I was like, yeah. So does that mean I couldn't get HIV? And, it was like protecting the fact that if someone got pregnant, they don't want to put that woman at risk for risking the child, the baby. But also, I found when PrEP first was coming out, it was all about men. And I was like, so why are we not allowed to recommend it for women? If it works for men, why can't we recommend it for women? And there we went back again, is they didn't study women and PrEP. So they couldn't advocate for it because they didn't have the research behind it. They didn't have science to back it because, once again, we weren't included. And that's where, girl power, speaking up for ourselves, saying, hey, I'm over here, don't forget about me. And also women sticking together, working together. I hate seeing the bickering amongst females sometimes. And we see it, teenage girls fighting with each other over a boy or over clothing, fashion, those kinds of things. Hey, we're talking about a serious illness that if you're bickering over, you're missing out. You're missing out on something. And I think we need to support each other and be there for each other as women. And I see this in our women, I'm jumping off a little bit, but our women's group, we have a CAN Community Health offers a women's support group or women's group. It's women getting together virtually. We're doing it. Any woman living with HIV is welcome. We do it the third Thursday of every month at 10 a.m. And we have a good group of women that are joining. So it's been it shows that working together and supporting each other can really help not only prevent, but to help living with HIV, because we have each other to rely on and not feel alone. I mean, so many So many ladies, when they come into our group, say, I thought I was the only one. I didn't know that my neighbor down the street could be someone living with HIV. I didn't know I could go to this location and get support and get help. So I think working to support each other as women is really, really important.
Absolutely. Thank you both for sharing that. You both touched on something that I do want to bring back just a second. So, really quickly though, for those of you that are just joining us, my name is Jasmine. I'm here with Nadia and Debbie. We are all with CAN Community Health, and today we are having a fabulous discussion on National Women and Girls HIV Awareness Day, which is today. And amongst our conversation, PrEP came up. PrEP is my baby. It's what I do here. But maybe for those of you who are not sure what PrEP is, so PrEP stands for pre-exposure prophylaxis. And it's this magic medicine is what I like to say, right? And what it is for HIV prevention, right? Not treatment, prevention. So if you take it every single day around the same time, and if taken correctly, which is every day at the same time, right, 99% effective in preventing HIV. So that sounds familiar, right? Yes, it sounds like birth control. That's the idea. And it's fabulous. And so yes, when we first had PrEP, women were left out of the conversation. But that is one of the focuses that I have for Women and Girls Awareness Day this year, is making sure that everyone knows that PrEP is for everybody. We now have that research. We now have those studies that show that women can also take PrEP, and that's okay. If you have questions about PrEP, or you're thinking, that sounds pretty good for me, and you would like to start PrEP, CAN is a PrEP provider. We have offices all over the US here. So please feel free to send us a message on whichever platform you're watching this, Twitter, Instagram, or Facebook, and we'll be sure to connect you with the right people. But that's my little PrEP PSA. I'm done. Okay, very good. So when it comes to women and girls, Debbie, you had mentioned, we didn't really use women because of like the fear of pregnancy, right? And things like that. And so like you said, well, that didn't stop me from getting it, even though I'm childbearing age. So what the heck? So I do want to talk a little bit about mother to child transmission of HIV. So can you guys elaborate for us, how mother to child transmission happens, and then, what preventative measures we have?
I will go ahead and jump right in as the nurse practitioner, the provider in the group right now. So, simply put, mother to child HIV transmission happens when a pregnant person living with HIV passes HIV to their baby. So, it can happen during pregnancy, it can happen during delivery, or even through breastfeeding. So, perinatal transmission of HIV can always be prevented with proper medical care. So again, if they're taking the antiretrovirals, it should be undetectable. And also, all pregnant women, should get tested for HIV when they are, when they're pregnant. So if a woman has not received prenatal care, they should receive a rapid HIV test before delivery. And basically, if you just take the medication, you stay on top of your medical visits or lab visits, this will cut the transmission of HIV to the newborn. And I'm just going to add a little tidbit. Some people don't realize that, let's say that this child actually gets HIV. There are studies that show that some children living with HIV can frequently they're slow to reach important developmental milestones such as crawling or walking and speaking. Some do not gain weight or grow normally. So these are some of the consequences of actual transmission from the mother to the child. So, yeah.
Thank you. So yeah, HIV testing when folks are pregnant is incredibly important. We did a live session with a very good colleague of mine a few months ago about HIV in pregnant women specifically. So if you're watching today and want more information on that, if you go into our video archive on our CAN Community Health Facebook page, you'll be able to access that. Now, I know with mother to child transmission here in the US is not as common, but it happens. And so again, you know, that like, oh, it's not going to happen to me. We have to kind of get out of that mentality because it can. Now, what happens now? Let's say mom does everything right? They're at the doctor, they're taking their medication, they're undetectable, they give birth, baby's HIV negative, fabulous. What about like breastfeeding and things like that?
So no breastfeeding for mothers living with HIV. There are in some states or cities there are organizations that can provide the breast milk for you. In Arlington, Texas, we do use a organization called, I think it's called Mother's Milk. Don't quote me if I said that incorrectly, but it is an organization that we do use for our pregnant patients who have given birth and they would like, you know, natural breast milk. So there are organizations that should be some in every city so that they can obtain breast milk.
Yeah, thank you for sharing that. And I always like to make sure we get that information out there. Yes, because unfortunately you cannot breastfeed, but there are other things we can do. Milk donation clinics like the one you had mentioned, Nadia, formula. You know, these survive on formula, they'll be all right. You know, whatever your decision is, no shaming here.
Right.
You know, whatever you're going to do, you do it. But yeah, I always like to make sure that we talk about that because unfortunately, you know, we're not there yet in the research and things like that. So that's an important piece there. So thank you.
And I would like to add, I actually, just read this morning about some new research that's out about the transmission risk from breastfeeding to the child if mom is undetectable. And they're seeing great reduction in the risk to the child if mom is living with an undetectable viral load. Once again, another reason to achieve that undetectable viral load, because not only is that good for your own health in living with HIV, but now we're reducing the risk of transmission not only to partners, but to perhaps our children.
Yeah, I love that, and I'm that's very hopeful research. But I apologize to those of you that are watching. We've been kind of throwing this word around, and I just want to make sure it's clear. Can you guys talk a little bit about U=U and undetectable and what that means?
Yes, I'll let Debbie go.
Okay. Undetectable, U=U. Undetectable equals untransmittable. And what we have learned is that if someone is considered undetectable, and that is a blood test, the blood test will actually count the virus particles, HIV viral particles. Now that we have COVID, we have to be sure we know what virus we're talking about. The HIV viral particles in the blood. And depending on the lab, depending on the study, generally less than 200 viral particles in the sample of blood is considered undetectable. Some agencies, some clinics, some persons consider that less than 20 virus particles is undetectable. But in most of the studies, it was less than 200. And what that has shown is if you are at an undetectable viral load, there is zero risk to transmit HIV to another person sexually. And then we're also finding this out with pregnancy, to children, to babies, and also with the breast milk, we're starting to see this too. So U=U is very big, just big information, and so much has given so many of us living with HIV a freedom. Now, and I don't mean a freedom to go out and have willy-nilly sex and just be, irresponsible. it's this, and for myself, I can only speak for myself, feeling like you are walking around with something that no one wants and you don't want anyone to have. And it's that concern that we might transmit to someone. We might give this to someone. Um, I have been in a relationship with a man, and I'm married to a man who does not have HIV. And that marriage has been for, oh my gosh, I think 26 years now, which is like hard to believe. Now, my husband chooses not to use PrEP, and we've just chose other avenues to keep him safe. He is HIV negative, and 26 years of marriage continues to be negative. So finding out that if I'm undetectable and that I am not a risk to him, and to feel like a risk to someone else, it doesn't feel good. It just doesn't feel good. And so to know that if I continue to take care of myself, if I continue to take my medication as it's prescribed, get my blood work, see my doctors, I can stay undetectable, and I don't have to feel that concern or that negativity around feeling like I am a risk to someone else. So it's a very big breakthrough. UequalsU has been just tremendous, and it helps us with our reducing the community spread of HIV. Because if we can get more people undetectable, and even those that may be out in the world having condomless sex and not passing on HIV because their virus is under control, we can get to the end of this epidemic so much sooner, I believe.
Yeah, thank you so much, Debbie, for sharing. So important that we all understand what that means, because there's still a lot of stigma. We've talked about stigma specifically for women today, but there's still a lot of HIV stigma. About oh, can't date, or all of these different ideas. That are just not good for society. So thank you for sharing that.
Thank you.
Okay. So, last question I have for you all today. This has been fabulous. Thank you so much for spending your afternoon with me, or lunchtime, Debbie, and almost lunch, Nadia, with us. But what can we do to reduce new HIV infections amongst women and girls?
I will say something broad: increase access to healthcare services. And that may seem like an issue that, like, again, 2022, why are we still having this issue with access to healthcare services for women? But in some countries, and even some rural and remote areas in the US, women face significant barriers to accessing healthcare services. That includes denial of services that only require also discrimination from service providers that stems around female sexuality, and also poor quality services. Also, we talked about previously about going to your OBGYN, how it's stigmatized about the HIV testing. Like, you have to, instead of the provider giving you everything that you need, unless you ask for it, or ask for the HIV test, they were not going to do it. Also, just make it easier for women to be able to talk to their provider, and also having better quality service. Also talking about HIV prevention and PrEP in OBGYN clinics. As I'm thinking, over my life, since I've been going to my OBGYNs in the past, nobody has ever talked to me about PrEP. I've even had, clients and patients even tell me that their OBGYN told them, oh, you don't need to be on PrEP. So, educating potentially, other medical providers about, PrEP and HIV testing, and then just basically just eliminating those barriers and those misconceptions about women and girls as it relates to their risk of getting HIV.
Yes.
It sounds so simple, but testing, I mean, just testing, and that's what you're talking about, Nadia. It's like,
Yeah.
I have heard from so many women through and recent too, that they have actually said to their doctors, I want an HIV test. And they're questioned as to why.
Mm-hmm.
And, if you go to your doctor and you say, I'd like to have my cholesterol checked, they're not going to question you why. They're going to know that's because it's something important to your health.
Mm-hmm.
Well, if you go and ask for an HIV test and they want to know why, my suggestion is to go somewhere else to get care in general. But it's so sad to see that women are still getting questioned about why they want to consider that they may be at risk and that they want to take control of their health. It's we need to change that, and the only way I think one of the main ways we're going to change that is to speak up for ourselves. I give kudos to women who go into a physician and say, I want an HIV test.
Yeah.
And then if you do get questioned, as to why, because I am concerned about my health.
Yeah.
I want to make choices for me. And it doesn't have to be any further than that.
I have a add-on. Just I think we need to also create more laws and policies that promote more gender equality to help increase the likelihood of sustaining these efforts for sexual health among women. I think a lot of the policies and the laws that we have currently, they're so against women. They're very they basically disempower them. So if we can get some women up there to just and I know there are plenty of lawmakers and policymakers, women up there to fight for us more, so it can make us more comfortable with our sexuality, and so that we can be more sexually empowered. I think it will also help decrease the rates of HIV among women and girls.
Mm-hmm.
So I think it starts from the top down in a sense as well.
Yeah. No, it really does, right? Because when we are able to change laws, we can change ideas, attitudes, beliefs, right? And when those things are in place, people can feel empowered and not feel judged or embarrassed, or all of the things we kind of talked about today. They can self-advocate. They have a provider that's bringing it to them. Like you said, I have a lot of people who are doing, they're having the sexual health talk with their provider because they brought it up, making it commonplace. You shouldn't have to come, I love what we do, but you shouldn't have to only come to a can to receive sexual health services. Sexual health is health, and it should all, be one. So I hope we can get there one day. And I think a good place to start is definitely with laws and policies.
Mm-hmm.
Yeah.
Mm-hmm.
All right. Well, thank you so much to you both for being here today. This was incredibly eye-opening. Lots of great information shared here today. Those of you that are watching, thank you so much for joining us. If you have any questions, please feel free to leave them in the comments or send us a message, and we'll get back to you. But is there anything else that you would like to share with us before we leave? Is there anything that you would like everyone to know before we head out today?
I would just say that I'm glad there is a day for National Women and Girls HIV/AIDS Awareness Day. I'm glad it is a day that we bring a focus to this. I think that there is a lack of inclusion of women
Yeah.
in studies when it comes to HIV prevention, and that goes back to the HIV, the PrEP trials, and also there is a lack of inclusion of women in HIV related research.
Mm-hmm.
And I think that we need to continue to enforce or push for the inclusion of women, so that even the women who are living with HIV, they can say they don't feel alone. And then even and that's what I'm just thinking. I think I'm just we need to really kind of push more for that. Much of the research I do some research with women living with HIV, and I do see there's just a lack of research that is done, and we need to put more information out there.
Yeah. Our bodies are different. I
Yes,
mean, we know that in every other aspect of health.
yeah, hormonal changes is different. I mean, pregnancy.
Our weight, we are prescribed the same
Med-
dosage of medication as robust men.
yeah,
And then here comes this, petite little woman who is getting the same dosage. And then there's question as to maybe why she's having side effects. And the rest of the majority of those patients prescribed that medication don't have a problem. So we need to be individualized. We
hmm
need to be looked at as separate. And it just, it's absurd that hasn't happened in so many aspects in health in general. And then when it comes to when we're talking about sex, we still whisper. And you had said something, Jasmine, about embarrassment.
yeah,
I think, many women are embarrassed. And that goes to the confidence, but the embarrassment, it just really puts up those barriers and those walls from getting the information that is important to make those good choices. So we need to, and I still say, working together, women working together to support each other, not bickering amongst each other, not pointing fingers, but working together so that we can support each other and not feel alone.
Absolutely. Absolutely. Well, thank you again to you both. I appreciate you being here. Those of you watching, again, my name is Jasmine. I'm the prep program coordinator here at CAN. And we hope to see you guys again soon. All right, guys.
Thank
Thank
you.
you.
Thank you.